The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
It's been 7 weeks now since I was diagnosed with diabetes.
What you don't know can kill you, and there may be as many as 8 million Americans who don't know they already have diabetes. As a cause of death, it's number 4 in the nation.
People with diabetes have a risk for developing eye, kidney, nerve damage.
What is being done to detect this disease earlier, and how can you keep it under control?
Compliance is the most important thing.
It's an important issue, and we'll give you the facts today on Today's Health. This program is brought to you in part by an educational grant from Bristol-Myers Squibb Company.
It's often referred to as the silent killer. It's the 4th leading cause of death by disease in the United States, and there may be 8 million people who have it and don't even know it. I'm talking about diabetes. Hello, I'm Faith Daniels, and this is Today's Health. In this special edition, we'll focus on the silent killer. Diabetes has few detectable symptoms, and it can cause permanent damage before you even know it's there.
Hi, Adrian. How are you?
Fine. How are you?
Oh, good. Dr. Marks had asked me to give you a call to let you know that your glycosylated hemoglobin, which is your average blood glucose control over the past few months, has been a little higher than we would like to see.
What does that mean?
It's not excessively high, but we want to keep it from drifting up that direction. Diabetes is a metabolic disorder, primarily characterized by high blood glucose. It's an inability of the body to utilize glucose for energy.
Insulin is the major hormone regulating the nutrition of the body. Insulin ensures that adequate amounts of sugar and fat and protein get into the cells of our body. When insulin is deficient, this balance is disrupted and over years can lead to serious damage to many organs in the body.
That is involvement of heart, brain, kidney, nerves, leading to blindness, amputation, and premature heart disease.
There are 2 types of diabetes, type 1 and type 2. We think type 1 diabetes occurs because of total destruction of the insulin-producing cells. Insulin works okay if it's given to these people, but they just don't make any. People with type 2 diabetes have 2 problems at the same time. One is that their body does not respond properly to their insulin. They have what's called insulin resistance. In addition, they don't produce insulin normally from the insulin-producing cells. They produce some, but it's not enough to overcome this resistance problem.
90% of the people that have diabetes in the United States have type 2 diabetes. Only about 10% have type 1 diabetes.
Because I was in denial for a long time with my diabetes, complications arose. And I had a stroke, which was very frightening because the whole left side of my body didn't move at all. I have diabetic neuropathy in my thighs, and I had an angiogram 2 weeks ago.
The numbers are frightening. About 16 million people in the United States suffer from diabetes, and about 15.2 million of those cases are diabetes type 2. Unfortunately, only about half of those have been diagnosed, and fewer still are receiving therapy to manage it. The costs of health care and lost productivity due to diabetes have soared beyond $100 billion a year.
Because of the large number of individuals who are walking around with diabetes and are undiagnosed, the American Diabetes Association developed a task force that met for approximately 18 months and, based on very valid scientific data, have lowered the diagnostic criteria for the diagnosis of diabetes mellitus.
The effects of early intervention on hospital stay and costs of care is going to be enormous. The majority of hospital costs for diabetes have to do with kidney disease and heart disease, both of which are largely preventable if they are identified or prevented by aggressive management early on.
I was diagnosed with diabetes almost 2 years ago. At first I was really kind of relieved, which sounds strange, but I had known there was something wrong for probably about 1.5 years before that. So although the diagnosis was a little shocking, I was kind of relieved to find out there was actually something wrong and there was something I could do about it.
How are things going?
Pretty well.
Watching your diet?
Yes.
The goal of testing in terms of making a diagnosis is in order to more aggressively begin an intervention program.
You can't see anything happening to you. So, and when you're 26, 27, something like that, you think you're going to just go on forever like this. But I was a little scared. Not scared enough to do anything about it.
In 1998, the National Diabetes Education Program will launch a public awareness campaign to alert the general public, patients, and healthcare providers to the dangers of diabetes, costs of advanced treatments, and the benefits of prevention and early management.
We have the results of your repeat blood sugar and your glycohemoglobin. Early diagnosis and treatment of diabetes, I believe, is critical if we're going to be able to afford the cost of taking care of our patients with diabetes over the next 20 to 30 years.
I realized that with proper management I can have a long, healthy life, and especially with my daughter, I want to make sure that that happens.
I have started a management program, and it has changed my life. There are people to go to, like the dietitian, the diabetic advisor, and they show you how to work the machine. And as a result, I have to take my blood now. I test it 4 times a day.
I would say to the average person, are you overweight? Is there somebody in your family, doesn't have to be a parent, can be further removed, who has diabetes? Are you a member of a minority ethnic group, anyone in this country? Are you getting on in age? Are you above the age of 50, 60? And if you're a woman, did you have diabetes in pregnancy? If you have any of those characteristics, you are at increased risk for diabetes and you should be checked for it.
You just found out you have type 2 diabetes. What's your next move?
My initial goal for the diabetes management program is losing weight.
How do you manage to keep the symptoms at bay?
It is the patient who ultimately must manage his own diabetes.
How to properly manage diabetes. Next on Today's Health.
Experts say that with appropriate screening and testing, we could identify up to the 2 million of the nearly 8 million undiagnosed Americans with type 2 diabetes. For these people, adopting a program to manage their blood sugar level now could prevent serious complications in the future.
My diabetes program, and the initial goal is exercise and weight control.
It's been 7 weeks now since I was diagnosed with diabetes, and I've lost 20 pounds, and I've changed my diet almost completely. In fact, I have completely changed my diet.
Before I had diabetes, I ate what I wanted to. I exercised once in a while, but I had to turn that all around.
Type 2 diabetes is a situation of what we call insulin resistance, that in these patients there's plenty of insulin to go around, but the insulin cannot be utilized correctly.
It is a challenge to be on that on a program for weight reduction and exercise.
Good morning, Lenny.
Good morning, Chris.
How are you?
Fine, you?
Good.
Yes, I feel better because I modified my diet and exercise. I do now no less than 3 miles a day. And I go up to the gym and work out in the gym with weights.
Because no matter what age, you should always exercise. Right?
When a person with diabetes comes to see me, their biggest concern regarding their meal plan is what foods I'm going to tell them they're not allowed to eat. So off the bat, I usually like to tell them that there is no food that they cannot eat anymore. that we can always work it into their meal plan if it's a favorite food.
Previously, I would skip breakfast and often skip lunch, eat a large dinner and a lot of junk foods. And my diabetes doctor explained to me how important it was to eat all your meals, have them balanced.
For approximately half of all patients on management programs for type 2 diabetes, dietary modifications and exercise are not enough to lower their blood sugar level to an acceptable level. These people must often turn to oral medications.
The older classes of medications for treating diabetes are the sulfonylureas. And they've gone through 3 generations of change and improvement. The original ones had side effects that included abnormalities of the kidney handling of water and salt. And some of them, one in particular, had a very long effect.
One of the problems with sulfonylurea therapy is that they don't work forever. And one of the problems we ran into of course, was weight gain with these patients, which worsened their response to the sulfonylureas, and also just acclimatization to the medication, and they stopped working. So what we ended up needing to do was either increase the dose of the medications, go to different types of sulfonylureas, or go to insulin.
Originally, I started with 2 types of insulin. One was a fast-acting and one was a longer-acting insulin. And I would have to inject them into my body, and I had pretty heavy dosages of it.
Glucophage came along to this country in 1995 and had been in Europe and other countries for decades.
Personally, I prefer to use glucophage in combination with the sulfonylureas because you get all the advantages of both drugs, and they tend to work more effectively together.
The key to a successful strategy in preventing the progression of type 2 diabetes and the serious complications it can cause depends on patient self-management. Daily compliance with a program that includes medication, a special diet, and regular exercise are essential in helping to keep blood sugar levels under control.
Okay, it looks like you're doing really well. Your blood pressure is very good. Your wounds are healing well. The patient obviously has to follow the diet, the exercise regimen that's being prescribed by the endocrinologist and or the cardiologist who's following the patient. And if they don't follow that, the doctor can't do it for them.
I think a good attitude coupled with a good understanding of diabetes is probably the 2 keys to being successful in self-managing diabetes.
My goal is to have good health, to manage my diabetes, to exercise, weight control, so I could have and look forward for my grandchildren as they grow up.
I would like to be able to live to be older, and I want my children to see me to live to be older. So just mentally, I've gauged it that I'm making myself do these changes so I can live a healthier and longer life. And I have no difficulty whatsoever doing these things.
The 4th leading killer, 54,000 amputations, $100 billion. Startling statistics, but to every case, there's a compelling personal story.
Over a span of approximately 3 weeks, I lost approximately 20 pounds.
We'll tell you one when we return.
Each year, diabetes causes thousands of deaths and thousands of cases of heart disease, blindness, kidney failure, and amputations. But numbers in the thousands don't tell the whole story. Every individual who's challenged by diabetes has their own special story. Here's one of them.
Many years ago, I started having extreme weight loss problems. Over a span of approximately 3 weeks, I lost approximately 20 pounds. And I was hospitalized, and within 24 hours of my hospitalization, they came back and told me that I had diabetes.
Fortunately with Bob, he found out he was diabetic because he got so sick with the rapid onset where he lost a lot of weight over a couple of weeks and went into the hospital with very high blood sugar and that.
It was very frightening. I think my first thing that crossed my mind was going blind.
When Mr. Jones first came to us, he had already had diabetes for 15 years at least, and he had already, unfortunately, started to show some signs of the difficulties that you can run into. For instance, he had some numbing of his feet. He couldn't feel what he was walking on all the time. He had some up and downs of his blood pressure. He couldn't regulate his blood pressure properly, so he would get dizzy.
When I first learned that my dad was diagnosed as a diabetic, I was very young. I don't think I was maybe 7. And I had no comprehension whatsoever except that he was in the hospital for a period of time.
How many of those sugar tablets do you take when you feel that you're low?
2 to 3. 2 to 3. They bring me up to a point where I can check my blood sugar and see if
we talk about the symptoms. How can he recognize his symptoms of his complications? And then, of course, we talk about the fact that we're not going to let this get out of hand.
And this right here is what was it?
Compass.
That's a compass.
My son Maxwell doesn't understand the concept of his grandfather being a diabetic, but he does have a 4-year-old's grasp of the fact that his grandfather will tire easily when they're playing, that if his blood sugar levels are a little bit out of whack, he can become testy or he'll need to have a piece of fruit or some candy.
When Papa and I go catch frogs, he gets tired. Papa gets tired because he has diabetes.
I think the biggest cause for the fear at the time of the diagnosis was my lack of knowledge about diabetes. It was the unknown.
In the type 2 diabetics, what we try to do is when they're initially diagnosed is first of all make sure that the blood sugars are not too high so that we don't have to treat them acutely. But then we try to change what they eat, so we do food records for a couple of days, for instance. Then we try to change maybe the timing of when they're eating, less snacking, less carbohydrates, and then we try to get them to move.
What time did you have your low blood sugars?
About 5 in the morning.
And
my doctor ordered for a dietitian to come up, and we went over the types of food that diabetics should eat, going into meal planning and food exchanges. The diet and the exercise is very important with the diabetes. I have gotten to the point that I refuse to sit down and say I have diabetes and I can't do anything. My wife and I, we enjoy walking for exercise. It's very relaxing. We try to walk at least, a mile or 2. And we also have a treadmill here at the house. These were all, lifestyle changes that were very hard in the beginning. And it took quite a bit of time to get used to them.
When patients and their family really become committed to the cause of prevention, so to speak, most patients do extraordinarily well.
Now I check my blood sugars at least a minimum of 3 times a day, usually 4.
A lot of people will get up in the morning and have a cup of coffee and their breakfast. Well, Bob gets up and has his coffee and checks his blood sugar.
Over the years, my father's health, I think, has gotten better due to the fact that there's more information available about diabetes than there was 20 years ago.
All in all, I'm still alive after 26 years. I can still do most of the things I want to do. I still enjoy my photography, enjoy my family, enjoy my grandkids.
We want to keep him as healthy as we possibly can. I want to keep him around for a while. We enjoy each other's company a lot, and I just don't know what I'd do without him.
Overall, the whole experience has been very positive, though. It's taught me how to manage a disease. It's how to manage a killer. If I didn't manage it, I'd probably be dead. I remember some time ago, someone had told me that I was really lucky that I had diabetes. And I didn't understand it first, and they had told me, they said, well, you're lucky. Said, at least you have a disease that you can control.
If you're on the internet already, or thinking about it, you'll be amazed at how much information there is concerning your health and well-being. For a good start, visit our Today's Health website at www.vstar.com. The tragedy, costs, and suffering diabetes causes in the United States every year has created a national health crisis. But there is hope. With early detection and management, much of the trauma and expense can be avoided, and we may even be able to prevent a dangerous disease from becoming a killer. I'm Faith Daniels. If you want more information about anything we've covered on this show, visit our website at www.vstar.com. And join us again next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.